Welcome everyone to Office Hours. I'm your host, Stuart Newsom, and today we're diving into a topic that rolls around the same time every year and always stirs up things. And I'm talking about re-verification season. So the title of today's discussion is Re-verification in Action with Frontline Lessons from the Field. And it's that time of year when coverage resets, payer portals slow down, and teams scramble to stay ahead. But as we'll hear today, it doesn't have to be that chaotic for us all. So there are smarter, more strategic ways to prepare. Now, joining me today is Randy Boner, who's the Associate Director of Client Success here at Infinix. Randy works directly with providers and revenue cycle teams across the country, helping them modernize workflows, automate eligibility, and navigate that January surge with a little less stress and a whole lot more control. So, Randy, it's really great to have you with us today. I'm looking forward to our discussion. Just tell us, how you doing?
Yeah, I'm doing great. Definitely happy to be here and excited to talk about our favorite topic, re-verifications.
Yeah, no, it's everybody's. It tis the season, right? So, yeah, so I think this topic hits home for just about everyone in revenue cycle, but just on different levels. Kind of depends on what specialty you are. So we're going to unpack what makes re-verification so challenging, especially for PT and OT groups and groups that are similar to that type of specialty. We're going to explore how preparation, prioritization, and automation, and that's a lot of Asians, can help teams stay ahead of the wave rather than getting caught up in it. So we'll talk through practical steps for December prep, how to prioritize work in January, and what automation readiness really looks like in the field. So as always, we'll wrap up with a couple of audience questions at the end. So just want to urge you that if you're joining us live, please drop questions in the Q&A, but also encourage comments and insights. So if you have anything that you want to drop in there as far as any knowledge that you have on this subject, feel free to go ahead and do that and we'll share it as well. So with that, you ready, Randy?
Yeah, let's get it.
All right, so we'll jump right in. So the first question is going to be revolving around kind of what we like to call a reality check, and that is re-verification happens every year, same time, same every year it happens at the same time. Yet it still feels like a surprise for most practices. So what makes this season so disruptive, especially for PT and OT groups?
Yeah, for sure. Practices can really feel a negative impact and feel surprised if they don't have a clear playbook in place to handle this season. And for PT and OT groups specifically, the challenge could be that many patients that are scheduled late in the year, they carry over into January. And the best practice is to re-verify all these patients that are on the schedule. So when the new year begins, benefits, visit limits, insurance plans may change. All these things need to be checked. Even authorizations need to be resubmitted, and it all creates this perfect storm of admin work right as new patients are coming in at the start of the year, and it can really be a burden.
Awesome, awesome. Yeah, so I know that this nobody wants disruption, nobody wants to you know, go down this trail, but they have to because it's happening. The patients still have to be seen. They want to make sure their insurance is going to cover it. And it's just this change that just causes the tsunami that we like to call it here, if you will. So I think I've heard you say in the past also that prep is everything. And I believe in that. Being a Boy Scout, Eagle Scout, the motto is be prepared, right? So preparation just helps with anything and everything out there. But what does smart preparation, with the keyword smart there, look like for clients in December, from patient outreach to payer mapping to data cleanup?
Yeah, and that's a great point. If you don't prep, you're gonna fail. It's as simple as that. And the best organizations that I've worked with, they use the months leading up into the new year to get ahead of the chaos. This would mean, running eligibility and authorization reports to identify patients that are going to need re-verification. For the re-verification standpoint, that would be, patients that have plans that run January 1st to January 1st. Obviously these need to be rechecked. If you have a patient that runs July to July, you don't need to prioritize that. You also want to start your patient outreach, confirming, are they going to have any insurance changes? Well, do they know if any benefits will reset? That type of thing can be very, very beneficial. And also, you want to make sure that your payers are updated, any payer mappings are updated, and supporting of any automations that you have. Update your payer portals with credentials because you want to make sure that all automation, is ready to go at the start of the year. The last thing you want is, something to break and then you get even more volume that you're not expecting. And finally, cleaning up your data. So making sure that your facility information is correct, all your MPIs are correct, addresses, all that good stuff, your physician tables, ensuring that your order entry process is accurate and they've been entering the information in the right places. All these kind of small things will definitely explode if you haven't been, cleaning your data throughout the way.
Right, right. And, and hearing you go over all that, you know, I just get overwhelmed thinking about all the manual processes, that are possible. I'm sure, I encounter when I talk to clients, people are living in this spreadsheet hell, so to speak. Some of them like it, whether they complain about it or not, but there's also other processes where they're either calling the payer, they're trying to call the patients, they're trying to do that patient outreach, you name it. So where there's some automation, there's opportunities, for not just automation, but also AI, where there's agentic AI as well. And so there are some tools. I know we have some in Infinix that we've developed that help with those workflows. So you mentioned one, assessing which payers and workflows can be automated, before the season even starts, like payer mapping, insurance discovery comes to mind. How do you identify those opportunities and decide where to focus?
Yeah, that's a great question. And automation works best when you know where it fits. So if, first you want to analyze your payer mix, and this is something that we do here at Infinix all the time. Which payers can be automated, and which ones can't. We have integrations with clearinghouses and payer portals that cover a very wide range of plans. So it's easy to kind of pinpoint, where you're going to need manual touch and where you're not going to need manual touch. And obviously that goes into prioritizing work with your teams. And this, also goes back into the payer mapping. If your payer names are inconsistent or incorrect, payer IDs aren't updated, that type of thing, that would all lead to automation failures. So that's a big part of the cleanup that goes into making sure that you have the most automation as possible. Next at Infinix, we're going to assess your workflow consistency. So, automation always performs best when, it's a standardized process, you're getting standardized results, and it's repeatable. If there's use cases where users are handling, the cases differently, it's not always kind of the same workflow, or even, it's consistent where things like diagnosis codes, provider MPIs, these types of things are commonly missing. You need to address those gaps before you can kind of support it with automation. So identifying that is also important with prioritizing your work. And then specifically for PT and OT groups, clearly defining, if you need authorization and referral requirements, we know that's important for the specialty. But information like this is sometimes not available through the automation, whether that be through the portal or through the clearinghouse. So it's important to know, what all do you need from the payer? What are you looking for? And then what does the automation return to you? Because if the automation's returning a portion of what you need, then you're still going to need someone to go in and get the other portion that you don't. And that's a big part that, sometimes I've seen organizations miss out on. But
Right.
essentially running through those three filters, assessing your impact, making sure you have consistent data and workflows, and then making sure you understand your requirements and what the automation is providing you, will get you where you need to be for re-verification season.
Right. And I think you hit the nail on the head. There's a lot of people come in and they think AI or automation is going to solve everything and make it easier. And they don't really consider their workflows. So that is that key word that you mentioned in there was, understanding those workflows. And that is so important to assess, how are you doing it today? What needs to change, what needs to stay the same. There's always going to be that what the industry calls human in the loop, but there's human specialists that are going to have to be involved because you can't automate everything. It's just, from our experience, we see this even if we wanted to, because it depends on the payer. The payer actually holds a lot of the cards here, and also the patient. The patient sometimes doesn't inform you that they've changed insurances. Maybe they don't even know they changed insurances. Maybe they have some supplemental insurance that they're not really aware of. And that's where that insurance discovery, comes into play, which is part of that automation as well. So I know, because if you don't get the insurance verified, it's not going to happen, right? That's the first key.
Right.
Um, can you speak to the insurance discovery a little bit, like how that flows into the workflow a little bit? I know we talked about pair mapping, but now there's no idea is there additional supplemental insurance that could be leveraged as well?
Yeah, it's always good to find, any, plans or coverage that the patient has that they might not even know they have. Um, Infinix does have a tool around that, insurance discovery. We have automation that goes into that. It pulls, any active coverage that the patient has. And what this does, it helps you, get your right eligibility and benefits. It will also get, that patient's chart in the system updated with the additional insurances. And discovering more coverage is just better for your business. So it's definitely a good resource.
Right, right, right. And so, once January hits, not everything can be tackled at once. So not only can you not automate everything, you got to consider those workflows as articulated very well, which is a good plan. But then once you figure out that plan, okay, what's next? So how do you help teams decide, what to automate, what to work manually, and in what order, and does that order change, I guess, depending on the payer and the patient.
Yeah, no, I think in general, everyone's goal is to automate as much as possible. So that's always what the goal is. So anything that can be automated, I think will be automated. So then it comes to the question is what will be prioritized with our manual workflows? And your top priority always needs to be your business as usual patients. So these are patients that are coming in for appointments in January. These cases need to be worked first. And ideally, what we do at Infinix is we'll have teams dedicated to these, different workflows during the reverification season. So, business as usual, we'll have a team that makes sure that the eligibility and benefits are all done before the patient comes into the practice. Um, and then we'll also have a team that works specifically on the reverifications, with the goal is to typically be done by the end of January, depending on, the size of the organization and volume. And then, making sure that you have a team that's dedicated to verifications. We'll make sure that you have a focus on the overall goal, but you don't want to lose touch with your normal business as usual patients. Um, and at the same time, we're always identifying the payers and workflows that are supported by automation. And these won't require, much manual work, but you would still want someone to oversee that to make sure you're getting the information that you need. There's no issues with the portals or anything like that. But again, that's not going to take much manual effort there. And one thing that the Infinix Patient Access Plus solution does provide is intelligent queue capabilities. That automates cases to the right teams. So I said that you should have a team for business as usual, a team for re-verifications. Our platform can automatically assign those cases to the right teams. You could do it by payer, by workflow, CPT, service type, all these different things. So you can have specialized teams working on your cases, which will give you better turnaround time and give you better quality. And it's a major advantage during re-verification season.
Yeah, that's amazing. I think the word that resonates with me when I hear you describe that is a word that we've spoken of here in office hours, and that is orchestration. It's, you have, the AI, you have the human specialists, you have all this automation, you have the work queues as you mentioned, but someone or something has to orchestrate all that, manage it, if you will, give directions on where things need to go, and you just hit it on the head, how orchestration is such a key part of that. We're automating the automation, if you will. We're AIing the AI, if you will. And I think that's really something that's unique. That's a missing component that goes back to understanding the workflows. That's why it goes back to understanding, what the client's needs are, what their workflows, meet them where they are, so then we can actually fit in the best solution possible for them. Is augmenting their staff, not replacing their staff. So that's essentially key. So just some lessons, from the field, if you will. Can you share an example, where these improved prep or automation, made a measurable difference or an impact, whether it's turnaround times, accuracy, or team bandwidth?
Yeah, absolutely. So one use case I can think of right at the top of my head is, this year we expanded our Medicare automation to support, a wide range of, plans and different coverages. And we expect that to be a major win for our clients this re-verification season. Medicare could be very time consuming, different portals with access issues, all things that you don't want to deal with during the season. So being able to automate our eligibility and benefits during this time is huge, especially in our PT and OT business. Our clients are going to see a big impact from that. In addition, kind of like I said with the queues, we've implemented this throughout all of our internal operations teams as well. So, like I said, having specialized teams to work these different buckets of cases is very helpful. We're already seeing improved TAT and improved quality. And the goal is always to complete re-verifications as quick as possible, but you also want to have good quality there as well. So, in the PT/OT world for Infinix, these two aspects will definitely get us to meet our goals.
Yeah, that's awesome. So, and and now looking ahead, you've got this experience, you've got real world experience and examples in the field of what works, what hasn't worked, but you probably also see some gaps where there's some innovation, could occur. There's maybe a two-part question, so I'll ask you the first part is, as automation and AI continue to evolve, what's next for re-verification? Are we moving toward predictive automation or smarter prioritization before the season even starts?
Yeah, no, that's what everyone's asking. So I would say, it's definitely the next phase of automation in this realm would be proactive intelligence. So we're moving beyond just automating tasks and actually going to be predicting them. So we're going to know which payers are going to change requirements, which patients are most likely going to need re-verifications, when they should be started, how to prioritize them. Knowing this ahead of time kind of goes into the prep work that we've been kind of talking about, and having AI to help you prep like this in very specific ways is going to be very important. And Infinix that, we're always actively investing in AI in all areas across our revenue cycle business. But, I could say, with the patient access lens, the predictive re-verification is emerging as a top priority. We just know how much of a hassle it is for our clients and how much they, need Infinix to, give them a solution at this time of year. So it's definitely a hot topic.
Right, right. And as a follow-up to that, I always ask guests this, if you were the czar of re-verification, verification in general, because re-verification is just verification, it's just at a huge volume at the beginning of the year. But if you were the czar of that, and also with prior authorization, what do you see that's glaring that you would day one say, I'm going to implement this. This is the change I'm going to make to this process. Don't want to put you on the spot, but that's kind of like almost a follow up to what you just stated.
Yeah, no, I mean, if I was in charge of an organization's, re-verification process, it all starts with, what I would call like monthly checks, making sure all your data is clean on a monthly basis. Don't wait to the last few months to start checking all these things. You should have processes in place to ensure order entry is correct, data is correct, your payers are always updated. You're always analyzing your payer mix to see what can be automated. It could be that maybe you're getting, just for example, 25% automation on this payer. But a simple analysis, identifying some of the error codes that you're getting from the clearinghouses, and then kind of moving that forward and fixing them. You can expand your current automation percentages, sometimes even faster than developing new ones. So that's one thing that we do here all the time. We're expanding and building. So you want to be on top of that year round. So by the time January comes around, it's just another month, and you have all the right processes in place.
Yeah, that's awesome. And it just occurred to me, a big key to that is, you can't change or improve what you can't measure. And so reports, looking at the performance. And I've always been an advocate of, we have KPIs for personnel, We have KPIs and reports and measures for certain work that's done by those personnel, or maybe even certain groups. We have reports for payers, but now we also need KPIs for the AI, that agentic AI, so to speak. And I know that's one thing that Infinix brings as well is you're able to your point, constantly checking monthly on these connections. Is everything updated? And also checking on the performance. We can give those reports to you, where you can actually look at that and dissect it and even adjust it based on certain points and dates of the year to see where improvement is done, where the gaps are, and take action where you're not just going in flying blind. So the information's key, knowledge is key. So I think that would be a great benefit as well. All right. So that's all the questions I have, Randy. So I'm actually going to go and see if there's any questions from the audience as I click on the Q&A here. It's give me a few moments here, but I'm also going to do have one available. And so here's a question. For organizations that still rely on manual re-verification, what's a realistic first step to start preparing for automation, especially when January is already approaching? You may have answered this a little bit already, but do you is there any other clarity for that?
Yeah, no, it's a great question. And even the organizations that are automating as much as possible, they still need to have workflows for their manual processes. So, any re-verifications that you're doing manually, what you need to do is get your data and workflows organized and documented. So this, I would start by mapping your payer mix, identifying which payers make up the bulk of re-verification volume, and start prioritizing that way. With the manual workflows, how things should be initiated. Do they require phone calls? Can you get them on the portal? Those types of things should go into how you prioritize your work. You want to document your processes to make sure you have good SOPs, people are following the SOPs, and the quality is up to par. You want to make sure that your data is always cleaned. So insurances, providers, making sure NPIs are up to date, so your manual processes can run efficiently. And then once you have that foundation in place, you'll have a good manual, process that's running efficiently. And then now you can start to work with a partner like Infinix that can, layer in automation strategically, where it can be supported, starting with, your most predictable payers or the highest volume workflows with the most impact. So, if you're still doing it manually, it starts with, with your manual processes, and then you should partner with someone like Infinix that has technology to automate more of your volume.
Yeah, and this makes sense to augment what you're doing, and partner with someone, a trusted advisor, if you will, because they're not only going to do the work, but we're also going to seek, how can those models be improved? How can the processes be improved? Working with you, augmenting your staff, in whatever means necessary. So, here's another question. I was kind of reading it as you were speaking, and I think you may have answered this already. So, but you've emphasized how preparation makes all the difference. How often should practices review payer mappings, data tables, or automation settings to stay re-verification ready? I like that term, re-verification ready throughout the year. So it's not just, a November, December issue of urgency. It's throughout the year.
Yeah, it's a very good point because staying ready year round is really the goal. We recommend reviewing payer mappings, data tables, order entry processes at least quarterly. And that cadence will keep you aligned with any payer changes, updated portals, policy changes, authorization criteria that could shift mid-year, and if you don't have eyes on it, you wouldn't know about it. For bigger organizations or really best practice, a monthly check is even better. Doing this on a monthly basis will get the right processes in place where you'll never have this problem. You'll always be identifying it, and then you'll always have, exactly what you need. Infinix does help organizations identify improvement opportunities in their data. That could be, saying that your order entry is wrong or order entry is missing this information and that's causing delays or it's causing automations to be blocked. It could be that, these lists of physicians have outdated NPI credentials, so we need to get those rechecked. Different things like that. We're always analyzing and making sure that we have our clients with the best data. And yeah, the most successful clients treat re-verification readiness like a living process. So it's not just once a year. It's keeping mappings current, data clean throughout the year. And then when you do that, January just becomes another month.
Yeah, awesome, awesome. Great advice, great questions. I don't see any other questions out there. Um, so Randy, this has been fantastic. Thank you for coming on. Really valuable perspective from someone who's actually working in the trenches with our clients. So thank you for being with us today.
Absolutely. Happy to join.
So if you're watching and your organization is already feeling the pressure of re-verification season, remember preparation is everything, as Randy just stated. Start early, work smarter, and lean on automation where it counts, but also consider you're definitely still going to need that human element involved. So you can find additional information at infinix.com. We have a lot of articles, blogs, case studies on this topic and many, many more around RCM. So be sure to check that out. And if you want to talk more about this, please reach out to us. We'll be happy to have a conversation with how we can help with your processes. So thanks again, everyone, for joining us today. Thanks again, Randy. So we'll see everyone next time.
Thank you.